If your dentist has recommended the All-on-X treatment, there are 3 things that they're not going to tell you. They're not going to tell you how much bone and gum tissue they have to remove in order to make the All-on-X prosthetic fit in your mouth. Patients generally have no idea about the irreversible damage of that bone removal, and that if something happens to your implants, they have removed all other options. The second thing is, if you pull your lips back on an All-on-X, you'll see that there's a transition between the fake gum line and your own gums. So when you look at the pictures that they show you, you'll notice they do not show gums because it has that transition line. The third thing that they don't tell you is that the All-on-X prosthetic creates a food trap in the transition line here that gives you stinky breath and grows bacteria. The prosthetic has to be removed a couple times a year to be cleaned. And that removal and cleaning process generally costs between $700 and $1,200 twice a year. Today, there's a much better option than the All-on-X, and it's called 3-on-6. The 3-on-6 does not have a fake gum line. It does not have the transition line. It does not remove bone. It's essentially teeth going into your own gums. So the 3-on-6 feels and functions just like your own teeth. So I tell everyone that if you need to have your teeth replaced, you really need to look into the 3-on-6. It really is the best option out there.